Actually, so I'm going to move on to the really tough question right now, which is, why is it that the price varies so differently between different places? I mean, I can understand if it's just like a few tens of dollars, but we're talking about those that offer it like very low tens and then those that are in the hundreds. So why is there such a huge price difference?
So I think as doctors, as clinics, I think patients' welfare results are number one, that's for sure. But I think that on the other hand, we also must understand that clinics are businesses, and businesses need to make a living, needs to make ends meet. And if the ends don't meet, then something must be missing. And what's missing? Well, maybe in order to get the same profit, they have to have a much higher turnover, okay? Or they might have less machines available. One or the other, something must give. Number two, a clinic must have enough tools. As I say, if you only have a hammer, then no matter what you see, you're using a hammer. And I don't think that that's a very customized approach. So as we said earlier on, there are 3 wavelengths, 2 machines are probably what most clinics would need for a very customized treatment. And also, the method of treatment might be different. So a lot of people advertise for Pico toning versus a full Pico treatment. So Pico toning is really an area-based treatment whereby we use multiple passes of low energy shots to rejuvenate the skin, reduce faint pigmentation, improve some skin texture and color. It's really not for really dark pigmentation, which requires a higher power treatment. So for that, you would go for a full treatment. First stage being individual spot treatment of the pigmentation. So one by one. It's very time consuming, but for darker, more difficult pigmentation, that's a must. And that's followed by a skin lightening treatment as a second stage. And the third stage, most clinics will use some form of collagen stimulating applicator. And these actually stimulate collagen with minimal downtime, causing the effect of smaller pores, rejuvenation of wrinkles, improving the appearance of acne scars, and even mouth tightening.
Okay. So it sounds like if I see that my doctor is constantly changing the applicator, it is a good thing, right? Rather than just using one.
Maybe not too many times. Or we should share you No, not that. Yes, in a way it's true. But there are instances whereby one size fits all, but not common.